Dr. Marshall here with Medical Specialty Clinic. Today I would like to talk to you a little bit about a product from Alani Nu. It's called Balance, and it is an excellent supplement. It helps support hormone balance and just overall metabolism, and it's a good thing. So I wanted to mention it. It's not something that I carry in the office, but I think it's such a good product that I wanted to share it with you and give you a little more information about it. And the name of the company that makes it, again, is Alani Nu. So that's ALANI space NU, and I will put a graphic up of the product online here. And this is the item in question, Alani Nu Balance. There's the Alani. It is a really good product, and I see a lot of patients with not just hormone imbalance per se, but polycystic ovarian syndrome, things like that, and this can really help with symptoms caused by that, things like that. So the first ingredient is inositol, or more specifically myo-inositol, and that promotes fertility and restores insulin sensitivity. It actually helps boost metabolism, some people think. So again, this is just for informational purposes. It's not meant to be a medical advice. There's no doctor-patient relationship. So obviously, please consult with your personal physician or healthcare provider before you start any supplements. But in general, these statements are going to be things that are promoted or generally considered to be supportive of these things, not necessarily causal. So inositol is the first ingredient, and people would consider that it promotes fertility and restores insulin sensitivity. Probably restoring insulin sensitivity in and of itself promotes fertility. If you're healthier, you're going to be more likely to be able to get pregnant or reproduce, things like that. So that is probably how that helps. And then it just supports metabolism overall. It's just a good metabolic support. It's in a lot of injections for weight loss. The MIC shot, for example, the MICC, that's got methionine, inositol, carnitine, things like that. So the inositol is a good ingredient. It's got glutathione. So they say on their website here that glutathione brightens the complexion, reduces wrinkles, and aids in hydration. So I would say glutathione is one of the most powerful antioxidants in the body and helps with that. So it's just good for overall health. It's a great antioxidant. So, people who are looking for health and longevity, you can't go wrong with taking a little extra glutathione. The next ingredient is DIM, D-I-M. I will let you look up the full spelling and pronunciation of what DIM stands for, but it is a very popular supplement to take, and it helps with estrogen metabolism. So our hormones come from cholesterol. So we take cholesterol, and that's why, animals have to have cholesterol. We take cholesterol and we make a lot of our hormones from it. In particular, it starts with pregnenolone and DHEA, and then those go to several different things, including testosterone, estrogen, progesterone, things like that. There is a great pathway. I'll let you look that up on your own. But DIM promotes the healthy metabolism of estrogen. So there are three estrogens. There's estrone, which is E1, estradiol, which is E2, and then estriol, which is E3. And they all kind of can be converted back and forth between each other. And women with PCOS typically have high testosterone, high estrogen levels. With symptoms of low estrogen, almost, they'll have hot flashes and things like that. So the problem is they're probably not clearing the estrogen like they should. And so DIM is thought to help promote estrogen clearance or estrogen metabolism. And when it goes to estrone or E1, then that is broken down and eliminated from the body through one of three different pathways. It's converted initially to one of three different things. 2-hydroxy estrone or 4-hydroxy or 16-hydroxy estrone. 16-hydroxy is unhealthy, so you really want the estrogen to be, or estrone rather, to be metabolized through that 2-hydroxy pathway. That is considered healthy and much better for you. And several studies have shown that the ratio of 2-hydroxy to 16-hydroxy is somewhat predictive of breast cancer risk. So if you have a lot of 16-hydroxy, that can be indicative of higher risk for breast cancer. So you want to promote the healthy metabolism and elimination of estrogens and estrone in particular, and DIM can help you do that. The next ingredient is alpha-lipoic acid. Alpha-lipoic acid here on the Alani Nu website states it's combined with myo-inositol, and that has been shown to increase insulin sensitivity in women who are overweight and have PCOS. So alpha-lipoic acid could probably do that, but it's also good for nerve health. We use it to treat neuropathy. Alpha-lipoic acid and benfotiamine are very good for neuropathy and things like that. So nerve health, alpha-lipoic acid is good. I think it comes in or it used to come in a product, an IV infusion with alpha-lipoic acid to help with nerve pain, memory, things like that. So it's really good for nerve health. Alpha-lipoic acid is a good supplement to take. The next ingredient is chromium, and I've got a video on chromium specifically, so if you want to watch that, I'll try to put a link to that video up here. But chromium greatly improves blood sugar balance and actually can help with diabetes. It's one of the first diabetic recommendations I give to patients before prescription medicines. Chromium and cinnamon, I recommend that right off the bat, plus or minus prescription medications. So chromium is very good, helps with metabolism, and can actually help you lose a little weight. It's not going to be magical by itself, but it combined with good diet, it can help with insulin sensitivity and blood sugar control. So it's a good supplement as well. I recommend a lot of chromium, or I recommend chromium a lot, rather. I don't recommend a lot of chromium. I recommend chromium quite a bit to patients. So folate is the next ingredient, and obviously folate, folic acid, that's a supplement that's recommended for lots of people, especially women before they get pregnant. Folate deficiency has been associated with neural tube defects in pregnancy. So if you have a deficiency of folate, the baby, the fetus, can have trouble forming the brain and spinal cord, or the neural tube as it's called in a fetus. And that is devastating. So you want to make sure you have a lot of folic acid or folate in your diet, and that's why a lot of our food is fortified with folic acid. Bread in particular, cereals, things like that have folic acid added to them to help, and that actually decrease the risk of neural tube defects quite a bit in this country. So folic acid is a good supplement, good for nerve health, obviously, if it helps with brain development, spinal cord development. So it also has a positive action on the cardiovascular system, can be good for emotional health, as you might imagine, and helps with fertility per the Alani Nu website here. That's a really good combination of products here in the Alani Nu Balance. And so just wanted to mention that. You might want to give it a look. It's not the cheapest supplement, but it is honestly hard to find this combination of things all together in a multivitamin or supplement. So you could put this together with just a general multivitamin, and I think you'd have a pretty good combination. So again, not medical advice. Always discuss any supplement with your provider, your healthcare provider, before you start taking it. And if you have any questions about this or anything else healthcare related, give us a call at Medical Specialty Clinic, or make an appointment and see one of our providers. You can contact us at 731-257-1500. I'll put a link to the website below and our email. So look forward to seeing you in the next video, and I hope you got something out of this. Please like and subscribe if you did get some information out of this that you can use or you appreciate. It helps the channel. And thanks again. Appreciate all our patients and all our viewers.